Good day, everyone. My name is Abimbola, and I'm joined with my incredible colleagues here, George from DRC, Abraham from DRC, and Valarie from Kenya. And today we are presenting our idea called AuthMed. AuthMed is helping to discover counterfeit medication with AI tools. And before I talk about our statistics, first of all, I'd like to share a story about Amina. Amina is a
Drink
young
this, my
5-year-old girl
love.
in Nigeria,
You'll feel
and she's a
better
child to
soon.
Zainab. One day she was running fever. She was running fever, and her mother quickly got out to get her a malaria medicine. Unfortunately, after some few days, she realized that this medicine wasn't working as it was intended. She was Amina wasn't getting better, and
Amina,
when they dug
look,
deeper,
it's
they
fake.
realized that the anti-malaria drug she got was actually
My
a
child,
counterfeit drug.
what will I do?
And this is not unique to just Nigeria. This is something that has been happening in all African countries, all over the continent. According to World Health Organization, about 10% of all medications in low and middle income countries are either falsified or substandard. In Africa, this is even more peculiar, and the situation is even more dire because recent studies have shown that over 20%, that is 1 in 5 of every medicine sample tested across our continent, were either found to be counterfeit or insufficient quality. Over 100,000 preventable deaths occur annually worldwide due to counterfeit medications. But behind these numbers, behind these statistics, is thousands of Aminas and a mother asking questions like, could we have known? Is there a way we could have known? Is there a way to have prevented this? And this brings me to our vision. Our vision is very, very simple. We have a mobile first solution. This is our AI powered mobile app accessible directly from the smartphone with no special equipment. We have our computer vision technology that analyzes multiple aspects simultaneously: the shape and color of the pills, the QR codes and barcodes, logos, packaging details, and instruction details. So it's comprehensive, it's fast, and most importantly, it's accessible. This is not just about empowerment for us. This is about giving everyone the ability to ask and answer a question that once seemed impossible. Is this medication authentic? Can I trust it with my life or the life of someone I love? Now I'm going to hand over to George, who is going to demonstrate how this app is going to work in real time. Thank you.
Thank you, Abimbola. I'm Byona, your mobile development AI integration engineer on these projects. Let me show you how AuthMed actually works. The user experience is incredibly simple. When the user opens the app for the first time, they have access to the onboarding screen, which highlights the AuthMed key mission. Once they complete this page, they are taken to the home page, which is simple and intuitive. There is a term and condition page where you can find privacy, regulation, how data is collected, and another side, there's an about page where you can find how this project is built, um, what is the vision of this project, who are working on this project. Okay, there is a setting page where you can customize our app. I think that we'll come back to this. Okay, let's take a look on how the magic is happening. First, the user will select or take via camera full size of the drug and submit it for the verification. After a few minutes, our model will come back with the result, which result can be authentic, suspicious, or unknown. Once the result is obtained, with a computed score based on the image details and its comparison in the database, the AI will provide a detailed explanation about the drug, indicating its common name, its scientific name, batch number, license number, manufacturing expiration date, and other information, as well as other necessary information like probability percentage, and to put the user in insurance. Finally, Ultimate does forget to say it's very important to return back to the pharmacist to learn more about these results. Okay, now let's try with another language. I choose the Swahili because it's a language spoken in my region. The app works on multiple levels. It's scanning the packaging design, analyze speed, characteristic, if visible, authenticating, QR code and barcode against manufacturer database, and checking text details for inconsistencies. All of this happens in real time in under 5 seconds. As you can see, the results remain practically the same, with perhaps some nuances, but in general, the model reached 87% of the same results after testing and verification. So to finish this demo, as you can see right now, AuthMed supports 12 languages, which are the most spoken languages across Africa. And we hope to move forward further by integrating even more new languages, expanding the database and adding regulation for each region or country for recognition and an experience more adaptive for each region. Thank you.
Now, you may be wondering, is this really possible? Can you actually deliver on this vision? The answer is absolutely yes, and here's why. First, mobile penetration across sub-Saharan Africa has reached 44% as of 2023, and smartphone adoption is projected to hit 87% by 2030. Our target audience are already using hardware they need in their pockets. The AI technology is proven. YOLO V11 models, which form the foundation of our approach, achieve 83% accuracy with just 234 milliseconds of latency. This makes real-time detection not just possible, but practical on standard mobile devices. So we have market validation. Solutions like RS Scanner have operated in Nigeria and Kenya, and Prezi is already providing authentication services. This proves that there's a real demand and that mobile-based medication verification can work in African markets. And finally, our team brings local expertise across 4 African countries. We understand the healthcare challenges, the connectivity realities, and the cultural context. We are not building from the outside in, we are building from within the communities we serve. What makes AuthMed different from existing solutions? Let me be clear about our competitive advantage. Prezi's platform only works with medication carrying its proprietary labels. It's essentially a product tracking system for their own clients, not a general authentication tool accessible to everyone. RS Scanner from RXL was conceptually similar to our vision, but it had critical limitations. It focused solely on pill classification from images using limited models, and most importantly, it's no longer functional and their app is outdated and unsupported. AuthMed takes a comprehensive multi-modal approach. We don't just look at pills, we analyze complete packaging, branding, detailed box information, QR codes, and barcodes. We interpret multiple AI models working together for more accurate detection. What truly sets us apart is our commitment to inclusivity and localization. We are integrating explanatory messages in local languages for each region. We are adapting our terms and conditions based on the legal frameworks and Ministry of Health regulations specific to each country. Let me pass on to Abraham, who is going to dive into our technical architecture and the impact we expect to achieve.
I'm Imani, Bahati, is a machine learning engineer and the backend architect for AuthMed. So let me walk you through the technology behind our solution. On the user side, we have a mobile app built with Flutter. It's so fast, reliable, and working smoothly on both Android and iOS devices. For healthcare administrator, we are run a web dashboard using modern React frameworks. Now, the AI engine, we are using YOLO V11 in PyTorch as our main computer vision model, combined with model for QR codes, barcodes, and the text recognition, making it a true multi-modal system. Our backend run on Python with fast API supported by PostgreSQL and MongoDB. Everything is containerized with Docker for smooth deployment and scaling. Because connectivity isn't always stable, we build offline capability with smart local caching that can sync when the internet is back. Finally, our MLOps is pipeline ensure model keep learning and improve as we gather really well data. So what difference does it make? For a patient, this means threats. A mother can check her child anti-malaria before giving it. A diabetic can confirm their cell is safe. That simple scan can literally save life. For healthcare workers, it's reliable verification tool, especially in area where regulators are thin. We are basically democratizing quality control. And economically, fewer Western treatments, fewer hospitalizations from fake drugs, and strong supply chain intelligence. Every scan become a data point that helps spot of counterfeit activity and a good policy decision across Africa. Here are what we are aiming for. We are aiming for 90% of accuracy in counterfeit detection, response time under half a second, so it feel instant. Full offline support for rural area, seamless fit into healthcare workflows, helping and not disrupting. And the scaling across Africa markets with localization for languages, regulation, and the medication databases. Ultimately, our goal is clear: a measurable drug in counterfeit drug, use wherever we deploy. So now I'll let Valarie will share how we are addressing technical consideration and execution these strategies.
Hello, I'm Valarie Chebet from Kenya, the data scientist and model evaluation lead for AuthMed.
Let's be honest about the risks. The false negatives could lead to dangerous medication consumption if our model fails to identify a counterfeit, and this potentially could lead to fatal consequences. The false positives also carry very high risk. If we incorrectly flag a genuine medication as counterfeit, a patient might discard life-saving treatment, particularly in problematic or resource constraint settings where replacement of this medication may not be readily available or affordable. And truly, this keeps us up at night. And that is why we are setting such high accuracy thresholds and implementing multiple verification layers to minimize the rate of these false negatives and false positives in our system. Now, data privacy is paramount, and our app will necessarily handle sensitive health information. We are implementing encryption, secure storage, and also strict access controls in the system. Users will have full transparency and control over their data, and we are committed to never selling or sharing personal health information of our users. The digital divide is a concern we are actively addressing. We recognize that the most vulnerable populations, those most at risk from counterfeit medication, may have the least access to smartphones and digital literacy, and that is why we are partnering with community health workers, designing the system for offline use, and also creating extremely simple user interfaces. We are also establishing clear liability frameworks and user education. Our app is a tool to assist in decision making and not replace professional medical judgment. We are building in clear disclaimers and guidance on when to seek additional verification through healthcare professionals. These ethical considerations are not obstacles. They are just guardrails to make our solution responsible and trustworthy. Now, let me be transparent about the risk and mitigation strategies. Technically, counterfeiters will evolve. We are building continuous retraining. Connectivity is unreliable, and that is why we've designed offline fast architecture in our system. Now, operational risk. Accessing counterfeit samples is hard, and we are partnering with customs and regulations. I know regulatory approvals take time, and that is why we are engaging ministries early with the first pilot approach. For adoption, we are training community health workers and using local languages in our systems so that we don't have digital barriers and technology distrust among our users. Now, sustainability risks. We are trying to diversify our funding beyond just grants to include B2B partnerships, pharmaceutical partnership. Now, the data security also, we are planning on having end-to-end encryption and conduct regular audits to mitigate data breaches that could be potential risks to our system. Now, our team, we have Abimbola Abe from Nigeria, our project lead. We have Imani Bahati from DRC, our machine learning engineer. We have Byona from DRC, our mobile developer, and me, Valarie Chebet from Kenya, the data scientist. So let me walk you through the execution plan, how we are actually going to build and deploy this solution. So the first phase is foundation and data collection. We are partnering with healthcare organizations, pharmacies, and regulatory agencies across our target countries, Kenya, Benin, DRC, Nigeria. And our goal is to collect over 10,000 authentic images and 3,000 confirmed counterfeit samples. This diverse data set, captured under various lighting conditions and angles, is critical for training a robust AI model. Now, the second phase is model development, and this is where Abraham leads the charge building our YOLO-based detection system, while I handle rigorous model evaluation and accuracy testing. Now, this will take around 5 to 6 months, depending on the data collection process. Now, Georges will simultaneously develop the mobile app prototype, and Alim creates our web dashboard. We are building and testing in parallel to accelerate our development. Now, the third phase is the pilot testing, and this is very critical. We'll deploy with 5 to 8 partner pharmacies and health centers across the regions in Kenya first. And these real-world pilots will reveal how the app performs with local medications, connectivity challenges, and actual user behavior patterns. We will collect feedback, identify edge cases, and refine the system before just the broader layout. And the time estimate is around 45 months. Now, for the fourth phase is the launch and scale. Now, after validating across the regions in Kenya, we're likely to expand to Nigeria, DRC, and Benin, leveraging our team's presence. Each market requires localization, that is, local languages, and also the Ministry of Health regulations in the specific country. Now, our expansion model is replicable for each new country. We partner with regulators, collect local data, localize the app, pilot test, then scale nationally. Strategic partnerships with Pan-African organizations will accelerate expansion. Our goal is to have a presence in 10 African countries within 3 years, focusing on markets with the highest counterfeit rates. We are building iteratively in Kenya and then learning continuously and scaling systematically across the continent. So, thank you.
Association. We have to partner with regulatory partners such as Ministry of Health, pharmaceutical agencies, and customs for counterfeit samples. We all need technological partners for our infrastructure and connectivity. We are going to be partnering with distribution partners like NGOs and supply chain companies, funding partners. These are WHO and Gates Foundation. What we offer is mutual value, real world counterfeit data, enhanced safety, measurable social impact. Every day we delay, more lives are lost. Those 100,000 plus deaths represent true families who deserve better. We have the vision, we have the team, and the roadmap. All we need is you. Investors who understand innovation serves the vulnerable. NGOs to help us scale. Healthcare professionals to join our pilots. The technology is ready. The team is assembled. You are the missing piece. Be part of saving lives through AI and help us ensure a fake medication never again takes life. Thank you.